This segment is sponsored by VCU Health.
The doctor is in and you have questions. As a community, we've been fighting COVID-19 for more than a year. Many of us are also waiting to be vaccinated, and all of this is causing increased stress and anxiety. Today, we're joined by Dr. Katy Maher, a clinical health psychologist at VCU Health's Level 1 Trauma Center, to share her perspective and coping strategies. Doctor, it's wonderful to see you.
Hi.
Dr. Maher, we're very encouraged to have this conversation because I think having the conversation is a big part of this. Tell us about your role in the trauma center and ways that people are responding to COVID-19 in the patients that you're seeing.
Sure. I'm a clinical health psychologist who's embedded in VCU's Level 1 Trauma Center. We have a huge interdisciplinary team who work on a patient's physical healing, and I like to think of my role as working on patients' emotional healing. So when we encounter a threat like a physical trauma or COVID-19, our body's fight or flight response kicks in, kind of like an alarm system that protects us from danger. So if you go back to this time last year, cue everyone frantically running out to buy all the Clorox wipes, toilet paper. Typically, the threat passes and our alarm system turns off. But what we found with COVID-19 is this has been a prolonged, constantly changing threat. So it results in increased anxiety, depression, and even health consequences. And then if you layer on those secondary effects, such as long periods of isolation, people working from home, children in virtual school, we're seeing really significant levels of psychological distress.
Dr. Maher, as you said, starting over a year ago and the response that we had then, it's been prolonged, it's been going on, it continues. It may have shifted, but it's not necessarily going away. And folks who hadn't encountered instances of anxiety and depression before maybe now are, and then individuals are exacerbated. How do you suggest people work with coping right now?
This is a difficult question because the impacts of COVID are so broad and far-reaching. One important strategy is just to normalize that all these emotions and struggles are expected in an event of this magnitude. Now, while this situation is certainly not normal, our difficult emotions are, and it can be really validating to discuss this with family and friends, saying I'm not the only one that's feeling this way right now. My most helpful strategy over the past year, both personally and also with patients, has been to really focus on the things that we have control over. So unfortunately, we don't have control over when COVID is going to go away, but we do have control over our own behavior. So I can wear a mask, social distance, and get the vaccine when it's my turn.
Dr. Maher, as you said, this continues going on, but when we started our conversation, we mentioned that's a big part of it. Having the conversation, talking with others, and being able to realize that you're not alone in this makes a big difference. What are you suggesting? How are you approaching it when people feel hopeless or they feel like things really are never going to get better?
When I'm working on difficult things with my patients, I sometimes like to take a step back and reflect on, why are we trudging through this? Like, what does this light at the end of the tunnel look like? And I feel like with COVID-19, it can be really easy to feel like your choices don't matter or that things are never going to get better. And I have found, both personally and with my patients, visualizing why we're making these sacrifices or doing all these hard things is really helpful. I've personally done this over the past year, visualizing what it would be like to get vaccinated or to see my family safely, and that hope of better days ahead helped me get through. It's been really cool to see these visualizations come to life as I've been vaccinated myself. I've seen my healthcare colleagues get vaccinated, and now even my family members. So it's been very exciting.
That's great insight to share. You visualize the ultimate of getting vaccinated. You've been vaccinated. If you don't mind me asking, what was it like? What was that experience like for you?
I provide direct patient care in the hospital, so I was able to receive the shot in late December. It was no big deal, and I had very mild symptoms. It was really difficult this past year working in the hospital, worrying about exposing my family and my patients. So I was really grateful for the opportunity. So even though I'm continuing to wear my mask and being careful, knowing that I have that extra layer of protection in my toolbox is really indescribable. Now, we know and are already seeing that vaccines can dramatically reduce the impact of disease in our community. So my advice is to get vaccinated when it becomes available to your group. In Virginia, the first step for anyone who has not yet been vaccinated is to go to vaccinate.virginia.gov or you can call 877-VAX in VA. I was really impressed with all the information on there. I went on there to help get my husband vaccinated, and there's an answer to almost any question you can imagine, and even a call line with questions.
Well, it's great to know that there are those resources, and certainly resources just like you and VCU Health. Thank you so much, Dr. Maher, for your time.
Thank you.
Absolutely. We'll share some more information so folks can visit. For more information about VCU Health, visit vcuhealth.org. And stay right here. There's much more Virginia This Morning in store.